Finally, we have an easy question. When should a clinical trial be considered? The answer is always. Immunotherapy is an incredibly hot field at the moment, and new agents with new or improved mechanisms of action are constantly being evaluated through clinical trials. And targeted therapy shouldn't be forgotten either. It remains a very active field of development, especially for patients without BRAF mutations who may still have other genomic aberrations that are amenable to treatment with targeted agents. There's also a growing portfolio of promising therapeutic options for patients with previously orphaned subtypes of melanoma. Particularly we've seen that with uveal melanoma, but patients with mucosal melanoma in particular remain an underserved group by existing systemic therapies. So a lot more work really needs to focus on them. A huge number of new immunotherapy modalities are making waves. And so these include things like personalized tumor vaccines, bispecific antibody therapies, and ImmTACs, the immune mobilizing monoclonal TCRs against cancer. There's even been a resurgence of interest in cell therapies, including TIL therapy. But importantly, clinical trials aren't just about testing new treatments. I think the neoadjuvant therapy and the explosion of interest in that field makes that point exceptionally well, because the questions aren't all just about what we give. It's also about how and when we give it. Simply moving a few doses of a well-established adjuvant therapy in resected stage 3 melanoma to before surgery has had remarkable effects, and is not a new treatment. It's an old treatment. We're just doing it slightly differently. So we currently have a wealth of surgical, neoadjuvant, adjuvant, advanced disease trials available. And the reality is that there may well be a clinical trial relevant to most patients at any stage of disease, and we really need to be thinking about this all the time. We also have so much to learn about diagnostics, biomarkers in particular. There's essentially nothing that is routinely useful in the clinic still. And we don't know much about patient experiences and quality of life. There's so much more to learn about supportive care and survivorship, and a lot more. And so there are also observational studies and registries that are incredibly valuable in this area, and they should also be considered in addition to interventional trials. But I think this is a simple question. When should a clinical trial be considered? Easy, always.